One of the hardest things when you're taking care of patients is that one person can't provide that whole care for the patient. You need so much different people, the physicians, the social workers, the physical therapists. So if we're not communicating well, or if we're under stress, which is often the situation in hospitals, if you're not communicating with one another during those stressful times, you start to attack one another, and in that way you're not really being able to provide the best care for your patients.
Culture change is probably the most difficult thing. It's not that, okay, you get to a point where, okay, we're there and now we can move on to something else. I think we all have a tendency to revert.
The pledge aspect started here at Emory University Hospital on our academic campus. And it was just an acknowledgement by that current chief of surgery and his team and the hospital administration team that just looked at the culture within the surgical services and said, you know what, we're better than this. And pulled together a multi-functional team, surgeons, anesthesiologists, nurses, techs, everyone within the environment, and just sat down and said, what is our pledge to each other?
The pledge is our covenant with each other as caregivers that we aspire to, and that we agree, even though we're not there, we're gonna pledge to a collective accountability for how we treat each other as teams, because we get the direct connection between how we treat each other as teams and clinical outcomes and patient safety.
It's not about just people telling you what to do, but you're actually being held accountable to a commitment that you made to the organization. It all comes down to the patient. That if we're speaking to each other, we're communicating well, we're forgiving one another, we're dealing with conflict in the moment, that we're going to be better as an organization and our patients will receive better care as a result.